Hello there and welcome to the eye hospital. I'm sure you know who I am. I am your consultant ophthalmologist, and it looks as though you're here for a very delicate cataract procedure. So I completely understand that your vision is compromised and you're going to struggle to see some of the imagery I'm going to present to you. But I'm going to do it anyway, just to cover all bases. So, where does cataract develop? So, chapter 12 of this book, it's within the lens. And we have the different types of cataract listed here. Okay, so we have a wide range of images here showing the different types of age-related cataract. After looking at your eyes, it looks as though you may have a combination of 2 or 3 different types of age-related cataract. So we have the posterior subcapsular type here. As the name suggests, this develops at the posterior portion of the crystalline lens there. So that is image A there. And this is how the cataract appears similarly to this image here, seen with a retro illumination when looking on the slit lamp. Okay, so moving further on, we have a nuclear element to the cataracts. This is how you see things as a general fog, and this is what it looks like with a cross section of the crystalline lens. We have a general yellowing whiteness, almost like a milky appearance. So there's definitely evidence of those 2 types of cataract. Now we talked about a combination. What I'm also seeing a slight amount of is looking on this page. Certainly not to this extent, but we have some cortical-like opacities. You can almost consider these to look like spokes on a bicycle wheel. So we have a few cortical opacities, like so, but to a lesser extent in your eye, migrating, originating from the nasal side and just starting to encroach inside the eye. So that's a little bit about the cataract and your particular type. That is cataract maturity stages, but we don't need to worry about that. We just need to worry about performing the surgery successfully. So I've looked inside your eyes, explained things to you. Now we just need to get you to sign some paperwork to say that you're happy to go ahead, that I've previously discussed the risks associated with surgery, and then I can book you in this week to perform the procedure. Okay, so you are in position for cataract surgery now. It goes without saying that you've got to keep very still. Keep your ocular movements to a minimum. Try not to turn your head, move any of your limbs, and if we can do that, surgery should hopefully go very smoothly with a successful outcome. So let's just make a few adjustments to you. Got to bring the head there. Good. Okay. Now at times you are going to be feeling some liquid going into your eye. that is just me providing some lubrication, because obviously the eye has to be clamped open with this little device here. So this is a little eye clamp. It doesn't hurt, but it just prevents you from blinking, and the eye drops will just provide that added lubrication to prevent your ocular surface from drying out. Okay, so if you're ready, let's apply the clamp. So open your eye as wide as you can, please. Keep looking towards my eye. Okay. There we go. Good. So just keep looking into the distance at one point, not at me, but just at an imaginary point in the distance. Like a little bit of lubrication there. Okay, so let's check the dimensions there. Just try and relax, and I'll get the job done. Shouldn't feel a thing. So I'm just determining the area for corneal incision there. Excellent. Relaxing. Excellent, you're doing a grand job. Just keep really still for me, please. Just a little device. I'm cleaning the area. Okay, you just see some instrumentation coming from the side there. Don't worry about a thing. We're just breaking down the cataract there. Doing a good job. We're just going to effectively hoover out the cataract from the lens sac now. Excellent. Excellent. Okay, so the cataract is removed. Now what we need to do is place an implant inside the lens sac just to replace the power that is lost from surgery. Just placing the implant inside the eye there. Don't worry if the vision goes a little bit blurry. Okay, let me just remove the clamp from your eye now. Excellent. Okay, now your job is to just gently close that eye for me. Okay. Keep your eye closed, please. And open your eye. Okay, let me just have a little look at the work there. Okay, I think we're going to make our way back to the nurses in the next room for further check.